My name is Jessica King. This is my video presentation of culturally competent care. I'm here at West Georgia Medical Center on the 6th floor with two of my peers. Alright, today we're discussing culturally competent care, and you have your PowerPoints there in front of you. The first thing we're going to go over is what is culture. Culture, there are many definitions for culture, but the definition we're going to look at today is the beliefs, shared beliefs of a group of people. Culture affects many things in people's lives, such as their language, diet, medical practices, religion, and social habits. So culture plays a very important part of caring for patients in a hospital, home health, or medical office site. Culturally competent care consists of first you need to learn the different practices of the cultures of people you take care of. Once you recognize that people have different cultures, you're going to need to adjust the plan of care based off those practices. Some examples would be Jehovah's Witnesses don't take blood products, so you may need to offer volume expanders such as saline instead of the traditional blood products that we use, or maybe you could even use iron tablets or something like that. Offering interpreters to non-English speaking patients is also very important. A lot of times things are missed in Hispanic culture because we don't speak Spanish and they don't speak English, so things are not translated across accordingly. Another example would be involving the patients when coming up with meal preparations. You may find that people of different cultures struggle in hospital settings with their diet because we don't really take that into consideration when planning meals in hospital settings. The reason that all of this is important to learn is because minorities and people of different cultures suffer tremendously in hospital and healthcare settings because we don't really understand their needs specifically. When we do take the time to understand what is culturally important to people, we can improve their quality of care. We can also develop trusting relationships between nurses, doctors, and patients, and patient outcomes have been shown to be improved. When providing cultural competent care, nurses must first learn their own culture and beliefs. It's important for you to understand to recognize what you understand to be caring to people of other cultures. There are also cultural assessments that we do at the beginning of each admission where you need to ask the patient what needs do they have based off their culture or religion. There's a learn tool that is very helpful when determining the cultural needs of other communities. But the most important factor is communication. When in doubt, it's always best to just ask your patient. Ask them, how would you like to be addressed? Do you understand the things that I'm telling you? Do you need an interpreter? What beliefs do you have? What kind of food do you like to eat? Any kind of questions related to their culture will help you to better care for your patient. And once again, I want to reiterate that interpreters are imperative when providing care to different culture patients. If an interpreter is not available, you may need to come up with a language line or something like that in order to communicate with your patients. It's not good practice to use family members because information can be confused when coming from healthcare providers through families to the patients. And the LEARN tool stands for listen to your patients, explain procedures to your patients, acknowledge information to your patients, recommend changes, and negotiate on what you can do and what they believe needs to be done. Now, specifically today, I'm going to talk about providing care to Latino Americans. In our society right now, in America, 16% of the population is Latino, and that number is expected to grow to 50% by the year 2050. So this is definitely a culture that we need to become more familiar with in healthcare settings. Latinos particularly face certain barriers such as language, lack of healthcare insurance, illiteracy. They have a genuine mistrust in the healthcare system. Latinos suffer from obesity. Their population has the highest obesity rates of any other population that there is. They also this leads to them suffering from diabetes, high blood pressure, and back to the mistrust in healthcare workers. This can often lead to the delayed treatment times. Also, it's good to note that some immigrants of Latino descent that come to America self-treat or are used to self-treating because in Latino countries, medications are available over the counter, so they don't need to always go to the doctor to get medications. They can just buy medications and self-treat themselves, so they don't always feel like it's necessary to run into the doctor every time that they're sick. Some things that we can do when dealing with Latino Americans to improve their quality of care are to provide an interpreter. Recognize that in the Latino culture, proximity to the patient matters. And what I mean by this is some cultures find that being in someone's personal space is offensive, but in Latino cultures this is actually welcomed, and if you are too far from the patient it may be perceived that you're not a caring individual. So sitting on the bed with the patient, being close to the patient, touching the patient, those are all important things in Latino culture. They do believe in hot and cold illnesses. They also believe that cold medicines should be used to treat hot illnesses and hot medicines should be used to treat cold illnesses. So if you can familiarize yourself with some of these things, then you know you can provide better care to your patients. Latinos really appreciate kindness, friendliness, and respect. They're known to use folk medicine as well as healers. It is welcome to ask questions about their family and personal matters. This actually helps to establish a bond with Latino Americans. Latinos are often very modest, and it is important to cover most of their body when providing physical assessments. You just want to uncover as little of the body as possible. And females prefer that if a male physician is examining them, there's always another female nurse present in the room. Another big thing in Latino cultures that we need to be aware of is that Latinos nod. They nod. That's something that they do in their culture, and this doesn't always mean understanding like when we nod in the American culture. So if you're explaining something to your patient and they're nodding to you yes, it is a misconception that they actually understand what you're talking about. They may just be nodding. Another problem that goes along with that is that Latinos view doctors and nurses as authority figures, and in their culture it is disrespectful to question authority figures. So if they don't understand what you're saying, they're going to agree with you anyway because they think that it's disrespectful to ask you any questions. So we as healthcare providers need to make sure that we encourage questions and explain to patients that it's important if they don't understand anything that we're saying to make sure that they ask us questions and let them know that that's okay for them to do. In the Latino culture, the elderly are of high importance, and they are usually the heads of the family and receive the utmost respect. So it's important to keep this in mind when caring for people. Also, they have a hierarchy system where the male is the head of the household. So even when you're dealing with a female patient, the male may be the one who makes most of the decisions along with the elderly members of the family. So we need to discuss that with the patients when they're first coming in, make sure that that's okay so that we're not violating any HIPAA regulations. But it may save you some time in the future discussing the plan of care with the husband and the family rather than just the patient. Another problem that has been noted is the addressing of the patient. Latinos often keep surnames and family names and lots of different names, so it can be hard to determine how you should address them. You can always show respect by addressing someone as senor or senorita, but if you're not sure what they like to be called, it's best to just ask, what would you like for me to call you? And that concludes my presentation. Thank you.